day uyu borom jasna pire soo ko bëggee fii si biir Gambia bi dawal foofu sa quality jasna your number one stop shop. Ana sama jigéen ñi dama bëgg ngeen jox ma seen nopp garme yi ndaxte quality jasna amal nañ leen ay til yu toj daala poos abaaya yu yiiw waaye it amal nañ leen ay boreda yu rafet boreda yoo xam ne pour góor ñi la ak pour jigéen ñi amal nañ leen body scrub yi nga xam ne nii dafay defar seen yaram bam nice waaye it fàttewuñ fa diw yi. Ana sama jeeg yu pare yi quality jasna amal nañ leen fa andi cuuraay yu neex house spray ak bépp xeetu baax pour seen biir néeg. Dama ne atum ren jii ku sa jëkkër mere ku ne yow la neex ndaxte quality jasna ñëw na si dëkk bi pour defar sëy yi. Makeup artist yi bàyyi leen gannaaw ñu ngi leen fa amal ay makeup product yu quality waxu leen léegi nii foofa sa Westfield jàkkaarloog monument bi wala nga jokkoo quality jasna si 250 0124 ak quality jasna taaral sa bopp taaral sa néeg waaye it bégal sa alaaji aas.
Prayers individually, please. Honourable Chair, I rise to report that a quorum does exist for the Select Committee on monitoring the implementation of government projects to commence business.
Thank you very much, Clerk. It has been reported that the quorum does exist for us to commence our meeting. Those in favor, please say aye. Those in favor, please say no. The ayes have it. And in our agenda here, we have already got the prayers. Now, can we introduce ourselves, starting from the members, from the last end?
Yes. Good morning to you all. I am Honorable Kemo Kasam, Cooperative.
Good morning. I'm Member of CACC. Good morning. I'm Keba Kebaro, member of this committee.
Good morning. I am Honorable Dr. Jam of Law from the Consultancy, member of this committee.
Assalamu alaikum. I am Honorable Musa Enda, member of the Council and member of the committee.
Good morning, Honorable Sirit Saad, member for Joshua, and chairing this meeting today.
Good morning. My name is Farah Jiwa.
Good morning, Mamadou Ba, a clerk to the committee.
Good morning, my name is Dr. Omar, Permanent Secretary, Mr.
Good morning. I am Dr. Mohamed Kinyasi, the Acting Director of Health Services, Ministry of Health.
SMS.
Assalamu alaikum. My name is Fagalo, Subject Matter Specialist.
Thank you very much. We have reviewed the agenda. The agenda was reviewed in your absence, though we are not in, but it was adopted. Then before going to the item number 3, I think we need to hear from our guest because the scheduled time was 10 o'clock. And then the guests coming in, we want to know what happened, what went through, why are you late?
Thank you.
If possible.
Thank you very much. First of all, allow me to apologize for coming late. I think there was confusion because what happened is that we were here on Thursday, select committee, health select committee. I thought it was the same show. Yes. Then we told them that we are coming on Monday at 10 o'clock. They say no. In fact, the meeting is 1:30. So this is even my communication with Honorable Kamara. Honorable Kamara sent me a letter. Maybe they were confused that because we have another meeting with them today also at 1:30. So he sent me the letter that the meeting is at 10:30. 1:30. So I was thinking that it is the same meeting. That's why I'm very, very, very sorry. I was just telling the minister that we will be at the parliament at 1:30. Suddenly this call came. Then in fact we were waiting for you. So it was a confusion of communication, but my apologies for that. So we are here, in fact, I have just communicated with my director of planning, DPI, who is now having the project. He's coming. If there is need any presentation, he will do it. Dr. Nyaz is also here. We can give an overview. But for the lateness, I think it was not meant for. It was a miscommunication between me and the Honorable Kamara, but I didn't know that it was different committees. Yeah, sorry for that.
Thank you very much, PS. I think, I mean, thank you very much, PS. One, I think, I mean, these are different committees, and letters were sent to you. And in those days, it was clearly indicated that the committee on monitoring is the one inviting you.
Okay.
I know you always deal with health all the time because health always invites you, but this one is a different committee on monitoring.
Okay, sorry.
I mean, we went through the letter, you'd have known that it was this committee. And then that would have time, you could have got time to call the chair of the committee or ask the clerk of the committee to give you the specific date and time.
Yes.
But it was very clear in that letter that you were invited by the monitoring committee.
Yes.
But next time around, just look at your letter, compare it to it, and know which one is inviting you.
I am very sorry because I know
that
that
one is from the health and the one is from the monitoring.
I am very sorry because I know that maybe the letter was received because I was not in town. Maybe it was received by PS2, but there's no apology, no excuse for that. I'm not giving any excuse, but I think the miscommunication because of yesterday. But definitely, I will not do it again. So thank you. Sorry for any.
I think you heard from them. They are apologizing based on the communication issue. They told us that been here. We helped invite them. They thought it was they called the chair. The chair told them it's 1:30. The mistake was they didn't go through their previous letter that we sent them.
Is the letter?
So that they are apologizing. So any other comment from the members not be
Okay.
Yes. Yes.
Yes. Thank you, Chair. I think you said it before. For me, I thought they did it deliberately. That was my thinking. But I also want to tell them that, like you said, it's a different committee, and the letter was sent to them. You should make an internal arrangement. Whenever no letters are sent to you,
totally agree.
Verify.
Totally agree.
Yeah?
Totally agree.
Anyway, no, I accept your approach.
Totally agree.
As long as he apologizes on what he has done, then understand that it was not good doing. So we just close that one and continue on that.
I think, Chair, that is henceforth, they should be looking at their letters.
Totally agree.
And
Totally.
they should communicate.
Yes.
It's a brief of communication.
I totally
Even
agree.
you travel, but already there is an office.
I totally agree.
That communication should have been there.
Totally agree.
Yeah.
So totally agree.
We have been sitting down for almost an hour.
Totally agree.
So as PS said, just so we were with the national, this health select committee. Then Sarah told me, you have a meeting 10 o'clock. Then the chair for the health select committee has said, no, it's not 10 o'clock. It's 1:30. So we went home with that opinion. The meeting is 1:30. So we were not, when we reached, we were not communicated to that there is a letter from National Assembly. It was on Thursday. Yeah. So we
sorry. Anyway, sorry for. Yes.
Yes,
we are very sorry.
Yes. Thank you very much, PS and the team. Yes.
No, of course.
Please, then must.
The chair will keep on that if we have to point out what that is. No, you should not say that.
That's okay, Chair. Please proceed.
Thank you, members. I think, PS and the team, it was in the moment that we had a meeting in your absence. And then the moment you are called, we expect that you respond. Because they also came very early, before 10 o'clock they were here. All of them were seated waiting on you. So how do you communicate? Because the clerk also had been calling. He called and he texted. When it was time, he called. No, there was no response. He sent text. There was no response. Of later, he was responding. People are coming. We concluded that we are leaving. By the time he got the response that people are coming. So I think next time, go to your mails, look at them properly, and then respond as quickly as possible. Yes, because to be honest, that's why we have been accepting it. Thank you very much. Then we go to the next agenda item number 3. Class presentation here on the capital projects. Yeah. So I don't know how prepared you are, whether the one who is supposed to do the presentation is around, or we have to wait for some time, or there is somebody who is going to lead us in.
I already communicated with Jibril, he is on the way. He's the one that give the nitty-gritties, all the projects. But in the meantime, we can have an overview. in terms of the past and the ongoing, as well as the future project. And then I think before the theoretical presentation, then Jibril will be here. So if you need for presentation, then he will do the presentation.
Yeah, because we need to know your current projects, the ongoing projects, their level, the cost involved, and if possible also the past project, the implementation, I mean part of it, how were they implemented, whether they were successfully implemented, where we still have issues. If possible, they settle their defect liability. No. So this is why we call you to know definitely your level of the preparedness that you have. Yeah.
Okay, let me allow Nyasi, who's the Director of Health Services, to let us run down in terms of the past project and the current. In terms of the financing, the litigators, definitely Jibril will come back. When he arrives, he will give you now, in terms of financing, for whether there is still deficit, whether there is still projects that are waiting for financing, all that so let me now give Dr. Nyasi to give us a rundown. Yes.
Yeah. Is it the past project?
Yes, past and current.
Start with the past project. Or the present, do you have the present ones?
Yes.
Give us the present ones.
No. Yeah. Why don't we allow them, because if you said past and present project, which we don't understand, allow ourselves. Then we put all projects for the ministry.
This is what we are saying. This is why we say past and present.
No, all of them. You know? No, because for now, the past projects are still going. The present one, they don't start. So we allow them to give us all the rundown of their projects, their cost, their time, everything.
Yeah, this is what I'm saying. You know, present.
From here to
present ongoing projects. When we say present, we mean ongoing projects. Past means that projects are already implemented.
and finished.
Yes, so this is what I'm saying. So you can give us that rundown.
So thank you very much, Chair, for giving me the floor. So for the past 5 years, under the stewardship of the Honorable Minister of Health, the Ministry of Health has been project that we are running. I will start with the Farah project. This is a World Bank funded project, and it started, if I could remember vividly, but the Director of Finance is on his way coming. He will give us a rundown of the projects we have for the whole ministry. The Farah project, that is a World Bank funded project, and it's cost the ministry almost about nearly to $30 million US, including counterpart contribution from the government of the Gambia. And the project is a 104 bed capacity hospital, which include 20 world standard ICU beds and 84 bed. It's a national treatment center for the country. This idea came up as a result from the experience we gained from the COVID. The COVID met not only the Gambia, but most countries in the world were unprepared to tackle the pandemic of COVID. So through the intervention, the leadership of the Honorable Minister, engagement of the World Bank, they approved this project. It's a 104 bed capacity hospital. This is the projects we are running at Parato, including a biomedical engineering unit and an imaging center that will have both CT scan, MRI, and other diagnostic center at Parato. And it will also have a blood transfusion unit. It will have a conference center, and it will also have a modern standard surgical unit that can do both kidney transplantation and cardiac surgeries. So this is the idea, the dream of His Excellency, the President of the Republic, to build a 1,500 bed capacity hospital in the country. This project I have mentioned is the first phase of the project, which is a 104 bed capacity, which is the first phase of the project. And in that we have all these facilities that I have already mentioned, a biomedical engineering unit, because we have been procuring a lot of expensive equipment. And if we don't have a biomedical engineering unit to service the equipment, meaning that all this equipment may last few years and we will not be able to repair them. That's why we came up with this idea to have a biomedical engineering unit to make sure that they service all equipment procured by the Ministry of Health. And the second project we are currently running is the food and drug testing lab, currently being constructed at the Bruceby. And it came as a result of the experience we had from the AKI, which was very unfortunate. So the World Bank is funding this project also, and the project is expected to complete June 2025. The one I mentioned in Parato is the project is going to be completed, inshallah, end of this year. And we are hoping to inaugurate it early next year, inshallah. So the other project also we are doing is renovation of all our facilities that have asbestos. As we know that asbestos is very poisonous to our human health. So we got funding from the World Bank to renovate all our projects that have asbestos. And countrywide, we have identified 13 facilities that need asbestos removal and total renovation of all the facilities. So it's from Buyam up to Fatoto, we have about 13 facilities. And the project should have completed September, but we had some delay not from financial delay because it's a World Bank project, but it's from the contractors. So we have agreed, hopefully, before the end of this month, they should hand the projects back to the Ministry of Health. And another project also is renovation of Buyam, both renovation and construction of new project in Buyam and Brikama. This is Brikama, for Buyam it's a World Bank project. It's going to cost the ministry about 390 something million. The director of finance will give us the figure. 390 something million dollars for both the renovation, total renovation of the whole facility, and construction of new dormitories and other new projects that is currently going on in Buyam and Brikama. Because Brikama, the facility is very small. Looking at the catchment area of Brikama, we need to expand the facility. So we are renovating the facility and expansion of the facility. So that will be able to cater the health needs of the people and surrounding of Brikama.
Funded by who?
The World Bank. So the director
fully funded by the World Bank.
Fully funded by the World Bank. Both Buyam and Brikama is fully funded by the World Bank. And also the renovation of the 13 health facilities, renovation and the removal and renovation of the asbestos is also fully funded by the World Bank. I cannot give the exact figure, but the director of planning is on the way coming. He will give us a rundown. So my people here will be able to help me some of the project if I forget.
Health post.
And the health post also we are constructing about 6 health posts in various strategic places in the country. One in Buduk, one is Kataba Omar, the other in Jisadi, and Balanga Jaloto, and in Kiang, Madina Sanchang, and Madina Angale. These are not World Bank funded programs, but they are Gavi funded programs. This health post came as a result of most of our RCH trekking areas. If you go to the places where our women and sisters normally receive, so the idea came up to at least dignify the areas where our women and sisters normally receive their antenatal services. Let it be standard area. So this came up as a result of that, and we are constructing 6 health posts in these areas that I have named. We have already constructed about 5 of them as a pilot, and it paid dividends, one in Brikama Nyambai, the other in Brikama Wellingara, one in Tampoto, Fonyi Tampoto, the other in Busumbala, the other in Makumbaya. So we did the pilot and it paid dividend. Because if you look at Brikama, the only RCH place they have is at the health center. And the catchment area of Brikama is unimaginable. If you go there on a clinic day, women will be there up to 4 o'clock. And because of these situations, some of them, in fact, prefer not to come for RCH to receive their normal antenatal checkup. So we decided to build these health posts as strategic areas, one in Nyambai, one in Wellingara. That will reduce the overcrowdedness of these facilities. And I don't know where. Yeah, Badia project. It's not yet on. It's ongoing. It's a continuation of the 6 health posts that we have. Yes, it's funded by Badia, and currently GAMWORK, they are doing the design, and they are going to work also on the tendering process. So this is going to be another 8 additional health posts around the country. The director of planning is here. He has he's going to save me from all this trouble because he has everything in his details. So Jibril, you are welcome. Few projects that I've remembered that are ongoing, but we have other projects that are funded by the World Bank. No, the Global Fund, which we are about to implement. Hopefully, within the next 3 months, we will, if our plan goes well. If you look at our Central Medical Store, for those of you who are fortunate to go to our Central Medical Store, it's very small. It was not built for purpose. It was because most of our materials and drugs are sometimes stored outside, and it's not an ideal place, and we secure funding from the Global Fund to build a very modern warehouse where we are going to keep our drugs safely, and the place identified for this warehouse is in Lamen. How do you call it? What's the name? Lamen, where we are? CDC. Lamen CDC, that empty land behind the Lamen market. So that is where we are going to have this project. So we are hopeful that before December 2025, this project is going to be completed. So DPS, if you can help me with other project that I missed.
Yeah. Mr. Kia. And then the good thing about all these facilities mentioned by director is that they have equipment component on it. So World Bank is going to provide the equipment for all those structures. The ICU, the biomedical engineering unit, the blood and blood transfusion center, and so on and so forth. So all the equipments are part of the project. We forget about the NICO also at Edward Francis Small Teaching Hospital.
Innovation at Edward Francis Small.
Yes. So there is a neonatal unit that's going to be, the construction is on. It's going to be, it's funded by World Bank also. Again, this also has equipment component as part of it. The ongoing refurbishment and renovation of Edward Francis Small Teaching Hospital and Polyclinic is at advanced stage. There has been some delay here and there, but now the contract is moving steadily, and we hope it will end soon.
That is GLF.
Yes, that's GLF. We plan to build a hospital at Basse and Brikama. The drawings have already been done, and hopefully the tender process will start very soon. As part of the Farah 2 project, we are able to secure funding from GFW through WAHU, KFW through WAHU to construct a hospital at Farah 2. This is a specialized hospital that will provide other services that are very specialized, such as kidney transplant and so on. Yeah, I think these are some of the things that I want to add. The ongoing oxygen plant construction at Edward Francis Small Teaching Hospital is at advanced stage. This will revolutionize our way of securing oxygen for our patients at the health facilities. So far, the one for Bansang Hospital and Demban are running very well, and it has given us at least an added advantage in terms of securing oxygen for our patients in the health facilities. I think these are some of the things that I want to add. Thank you.
Project funded by the World Bank is the neonatal and intensive unit for neonate, because if you look at most of our referral for neonatal cares are sent to Edward Francis Small Teaching Hospital, and the place they have is very small and they don't have the necessary equipment to deal with neonatal complications. So with this project, we are going to have the latest advanced equipment to handle all our neonatal problems in this country, inshallah. The project is ongoing, and hopefully before mid of next year, it will be handed over to the Ministry of Health.
Thank you very much.
So when they say counterpart contributions, it can be both on HR.
That's why I'm asking in inform.
Yeah. So Jibril can answer.
The government counterpart contribution was 100 million.
Was 100 million?
Was 100 million.
Okay, in cash.
Was 100 million.
Yes.
That was really COVID-19.
It was 100 million, yes.
Yeah, exactly. So now new priorities came up. So the 100 million was there. Now the ministry's priority is to build a new central medical store. A new central medical store right behind the Lamin market. That land that 11 people gave to government. So the Ministry of Health is using that part of the Gambia government contribution to build an administrative building for the central medical store. And the Global Corps is only going to build the store, amounting to $3.7 million. So in essence, the Gambia government contribution is still there, but will be directed to the central medical store in Lamin.
But my concern here is, you are redirecting the amount to somewhere else. That store, is it part of the current project that's ongoing in Farah?
No, this one is not in Farato. What he is trying to explain, in this Farato project, the Gambia government should contribute 100 million. So the World Bank said, okay, now we will put the whole bill of the Farato project. What we are now supposed to, we requested for them to support us for this warehouse. Now they said, okay, your counterpart contribution that you should have contributed for the Farato project, now reinvest it in the warehouse.
Thank you very much. And then how far with the warehouse?
No, we are on the design, and he can explain because he's in charge of the sharing committee for the warehouse.
You are currently on the design? Yes, please. Okay, that's fine. The other thing also is about the Banjul project. You made mention of two projects in Banjul. But My main concern is about the JLF one that they've been funded by the government. We are all aware that this project has been ongoing for a long time now, and people have been asking questions about this project. Some self-parliamentary questions, and the responses are always soon. Funds were created, additional funds were created for it to be completed in a certain period of time. But yet still, it seems there is not that much movement that people can see to say is happening. What is the problem with the Banjul project?
Yeah. Thank you very much, Honorable Chair. But Banjul project is a living project. You know, the reason why I'm saying Banjul project, you know, another issue has, our problem. We all know that the Banjul Hospital building is over 50 to 60 years old. You know, yeah, exactly, more than that. And renovating an old building, you know, comes with own risk. But we are certain that, the original scope of work, if we have remained within the original scope of work, the work would have been finished by now, really. But the problem we have is, you know, once you start touching a building, you know, other associated attachment of that building have issues. So you cannot just concentrate with your original scope of work without fixing, the line. But certainly now we have advanced. We are almost 90%. I wish the Assembly have a tour to the hospital maybe sometime this week or next week, and see the real progress that has the A&E is now completed. You know, the A&E is completed, and the 6 and 7 is also completed. You know, and there's only 2 wards now basically that are left. You know, but the hospital, if you have a walk to that hospital, you'll be really amazed with the entire transformation of the hospital. So one of the challenges we have is the implementation challenge, which we addressed, and the Office of the President recommended the ministry to hand over the project to GAMWORKS, which we did, and it has really helped us in moving the project. Now we are above 90% in terms of the entire project, entire project implementation, and we are sure that we are hopeful that in the next 2 months we should hand over, GAMWORKS will hand over the entire facility, to Ministry of Health. But now the other areas can be used now. It's just the hospital that are still requesting additional, work, which are out of scope. But the works are done, is done, well, done and ready to be handed over to the hospital.
Thank you very much. But it's on expect the unexpected. We know that very well. So, but there is a guideline that you are giving that should guide you through. And then the first contract that was awarded to a contractor with a specific amount that is to carry A, B, C, and D. The more the work is going on, according to you, you have been seeing new things coming up. How do you manage with those things that are coming in newly when it comes to the financial aspect of it? Because you peg it onto the finance that you have. You peg it on A, B, C, and D. Because we have been there. And then if you go to Nemban currently, people are suffering. If A&E is ready, why can't you open A&E and continue doing others? Why people from Nemban are being moved to Banjul? If you go to Nemban currently, people are lying on the floor. When there's a project in Banjul here, that's already, according to you, it's finished. Open it, allow people to have access to it, and then you continue with the other works.
I think that's very right. I think
with the A&E in terms of the work, as I said, maybe the DHS can give update on the operationalization of the A&E.
So what really happened? The project we cannot transfer back the A&E back to Banjul because we have started the renovation of the 6 and 7. There is another ward they call 6 and 7, and 8 and 3. So what we did, in order to decongest that place for the renovation at that 6 and 7 and 8 and 3 to be done and complete, we have to transfer the patients in those wards to A&E. so that we can finish the 8 and 3. But what we are hearing from the contractor, hopefully before the end of this month, the 8 and 3 and 6 and 7 will be done. So the A&A will now be fully operational. So it's in phases. So moving places in and out is very difficult. Even us is costing us a lot of money. We are in a haste because every day, how many ambulances are running from Banjul to Ndemba, transporting the stable patient from Banjul to, it's costing us a lot of money. And we are in a haste for this to get done so that at least we can save costs. We are equally worried and we are equally concerned. We want it to be done so that we will be able to save costs and, it's really difficult on our side. Because Banjul is the only referral hospital. All other hospitals across the country refer to Banjul. That is the reason why they cannot also reject patients, because this is a public hospital. If it is a private hospital, they can tell you, no, the place is full, go to another hospital. But Banjul, you cannot reject. That's why all the time doctors are also always frustrated how to manage patients, where to keep them. It's really a concern, so hopefully it will be sorted out very soon.
Yes,
But I guess you said $30 million, right? Roughly. Our essence of this meeting, we want to know the actual figure for the project. That is 104 beds, right? For the first phase. The completion will be next year, and we want to get right which date in next year, month. You talked about this of Farad. You said 190, sometimes in millions. This is I quote from you. You mean 390, sometimes in millions dollars. That I quote from you.
That is
that's Boyam and Brigham. Brighamaba, yes, Boyam Brighamaba. We want to know the amount attached to that project. Their time frame to finish the what to call it, the construction. The issue of Banjul Banjul Hospital, the removal that is going on in Banjul. How many millions of dollars is that is spent there, whether it's a GLF or a project? And I heard you said the part of it is GLF, right?
No, I mean the renovation is all GLF.
Okay.
Only the construction of the neonatal unit.
Okay, we want to know the amount spent and the amount that is going to be spent. We compare with the renovations. Because here, before you make any renovations, we expect you make visibility studies. Because it's an old building, right? Now, you have gone through on a renovation, things we are coming up. Before the project starts, it has to be in place before you start, how to call it, the project. Because already we all know it's a 60 years building that you expect all these kind of things that will happen on the way going. So whether those things were factors.
Yeah, but just to come there, I mean, the question is, were there any feasibility study
before the commencement of this project? And again, in your submission you said you have handed over it to Gamuwok. How can your ministry, doing this capital project, initially, we have a ministry that is under construction as Minister of Works. NRA is there, Gamuwok is there. These people were not involved in early stage. And already there are ministries that is taking charge on it. In fact, the supervisor of this project could have even given to this ministry to do that. We passed a law here, right?
And the essence of, making value for money, you being health experts at the end. We don't expect you people going for construction. I want you to make it clear to us. Because you said later you hand over the project to GAMWORK. For now?
Yes.
No, this is why, initially, they have not done it.
They were doing it before, but there are issues, that's why they started.
Yes, they will have issues because the technical background is not there. What do you expect from them? They could have engaged the Minister of Works, GAMWORK, and NRA. You understand?
That's where my colleague, that's where it used to be. It used to be GAMWORK doing it for them. Because most of these posts were done by GAMWORK, so by GAMWORK, and they were contacted by the Minister of Health. So they had this health post before. If I go to Bikramaba, Simon Kuchunki and others, they were all being supervised by GAMWORK. Then when they were trying to have their own PCU to be under their ministry, to see where they can be on their own.
No,
at the end of the day, it's feel that they have to go back to GAMWORK again.
Do they have that money to do that?
Yes, I think
No, I'm asking them now. Not you don't answer that. Do you have that money to do that? And again, the reason why I'm going there is because I'm trying to drag this thing. You have talked about this of Nemman. You go to Nemman today, you will cry. Last 2 weeks, I was there with Honorable Sambaj Jalo's sister, was admitted, Honorable. Before going for this capital, and you yourself know that you are going for a capital project, and it will not finish just a short period of time. You didn't work on the one that you are going to cater the patients. Today, go there. They are talking about fuel. I said fuel is the last thing of those patients' condition. Because even the mattresses that even these patients lie on is terrible. Go there. Even a paper whereby you are able to record the patients is not there. And the doctors and nurses, assistants, they are doing tremendous work on the care. But then they are not supported by them.
yes, I mean, just observe.
Let me-
Just observe you. I mean, what I want us to do is, we are talking about projects.
Yeah, no, I'm coming. No,
I'm coming. We're talking about projects. Can we highlight those issues? And then
no, because it's under the ministry.
I know where I know why you raised the issue.
No.
Because I guess you didn't come back.
Yeah.
It was concerned. That's why I
Yes, no.
opponent in the A&E. Because A&E is you see them being congested, because A&E is not ready.
No.
I think the A&E is in place. That's another thing.
No.
Even the banyas are complaining that if you have patients, they have to put in them back. Even they are there, but they have to never.
Yes. I'm coming. The reason why I'm bringing this because, they are building this structure. Those fairs that we have to keep our patients, sick people, in good condition. This is why they are building those massive projects. You understand? The reason why I want to bring this forward, Nemman should be at the condition of the Nemman. Them also to go and see what is happening in Nemman. But if you have a patient, you have to call the minister or the person who is next to minister. Let them make things right. Whatever. Things are not getting right.
Thank you very much. I think you asked him.
Honorable Chair, for giving me the floor. I think I will start from where the ongoing project at Farato. He did mention the amount of money that is being involved in that project. From there, he also mentioned the project that is going on at Brusubi. But he never go into details on that project. The one at Brusubi. We want to know, like he said, the amount of money that is to be injected in that project and the time frame of the completion of that project. You've also mentioned the renovation and refurbishment of Buyam Health Center and the expansion that is to be done at that health center. We want to know the amount of money that is going to be injected in those works. I also want to know because you did mention that there is, of course, a renovation work going on at VTH. I don't know how you award contract to the contractors, whether it was done, bidding process was done, and to coming back to his assumption on Demban. Honorable Chair, with your permission, I know you might, of course, interject into this. But like I once mentioned it at the floor that before you expand or you build these capital projects, we have structures already. Those structures need to be feed with necessary tools. For example, Demban, you yourself mentioned it. If you go to Farafenni, the same thing. The hospitals that we have are not fully equipped with I know you I'm coming, just allow me to come, please. Yes, I know. I know. Sorry for them. Okay, I know. Okay. He did mention about the delaying of renovation work at RVTH here. I want to know what is the cause of that delay. And during the doctor's deliberation, I know they must have challenges, but he never talked about challenges. And these are very, very important. You cannot tell us that all these projects are going smoothly. It's not possible. You need to know, at least tell us the challenges that you are facing. Thank you.
Thank you very much, Chair, for giving me the floor. Thank you very much, PS, and all your technicians here and the media present. Honorable Chair, in his deliberation, he mentioned that Farato project will be completed end of this year, if I'm right, end of this year. Yes. So, yeah, end of...
No, I think for the expectation of Farato,
yeah.
The Farato infrastructure is different from the Farato lab. But in terms, if you want to give you the completion in terms of fully with the equipment, well, now we are going to for the equipment now. So definitely end of this year might not be
No, the structural.
Yes, the structure, he said.
Yes,
it should be ready.
Okay, he said end of this year, it will be ready. Yes. That's what I heard from him. I just want to know.
Should have been completed.
Yeah, what percentage? Can you tell us the percentage wise?
Okay, percentage.
Yeah, percentage. The second question is in also your deliberation, you talk about the renovation of Buyam and Brekamaba, which is a very good move. But I just want to ask the ministry, looking at the CRR note, I don't know whether the ministry...
Is that a goal you are trying to shoot or what?
No. I just want to know. No. Yeah, but they mention about CRR South. They mention about CRR South.
No.
Just
Balangari is mentioned.
Yes.
Balangari, a help post.
Wait. He mentioned...
No, with all respect, sir.
No.
There is something like uncle.
Just allow me to learn. Just allow me to learn. No, it's not rule out. It's not rule out. No, I still go by that because he mentioned about he mentioned about CRR North, which is Brekamaba, CRR South, which is Brekamaba.
He didn't say South, he said Brekamaba.
No, he said Brekamaba. That's South. That's South. Honorable.
We have Jao.
Yeah, but I think Brekamaba, the one, the renovation and expansion that you are doing will be more advanced with the one in Jao.
Is it good? No.
Yes. Allow him to finish his question, then you respond.
Yes.
But if you want to interject at this point in time, we spend the whole day here.
Yes.
And then we don't have time. We are closing at 12.
Yes.
1 o'clock.
Yes.
So we have more than one question you have to respond according to questions. So allow them to ask questions, then you can respond. Are you done, Uncle?
Yeah, I'm done.
Yes, Uncle.
Yeah, okay, thanks so much.
During COVID-19, Ndemban was used as a treatment center for COVID-19, you know, and we spent money, the ministry spent money to actually renovate Ndemban, you know, up to the tune of around TAFs, with the other mobilization of the resources we have, initially invested around 2 million to bring Ndemban to life. But ministry spent additional funds to actually renovate Ndemban. So after the COVID-19, you know, when it was declared that, you know, we have to live with it, so the ministry also thought that, look, Ndemban cannot be left idle, and we need to renovate Edward Francis Moore. So Ndemban was upgraded a little bit. Then services were referred to Ndemban, you know. So the pressure in Ndemban now, and before we move, you know, the A&E to Ndemban was totally different, you know. So it's an ongoing, you know, issue. And the feasibility studies, we did an assessment. My director did an assessment, you know, with how do you call it, you know, in Edward Francis Moore. And the issue of the ministry having the mandate to do construction, I don't think we have a mandate, because we have a mandate to deliver services. We are delivering social services. So if you have resources to actually implement a construction project, you know, we should go ahead to do it. And we have implemented construction projects successfully. And, you know, we have worked with Ministry of Works during the COVID-19, when we were renovating some of our facilities. But the Ministry of Works equally does not have the capacity to be able to handle all government projects at the same time. Some of our projects got delayed. The designs were not coming on time. And then, you know, we wanted to engage the army, you know, during the COVID-19, when the entire country was in need of skill, you know, to upgrade some of our facilities to be able to hold COVID-19 patients. So we had delays. And in that, this particular construction, like any other construction, was tendered. And we initially tendered for a consultant, which is normal practice, you know. So we tendered for a consultant, and that consultant was Mahfouz, who won the bid as a consultant. Then they took our assessment reports, and then they built on the design. Then the entire facility was designed, and we went through the GPPA requirement, and it was tendered, and a farm was actually selected. So it went through the normal process. So the reason why we turned back to Gammo is not that we do not have the capacity. We all know how government projects operate. The problem is when a builder submits a certificate to you to do payment, you rely on Ministry of Finance to give you funds. So you don't have control over what time does the Ministry of Finance give you money. So you write based on that certificate, then you go to Ministry of Finance, back and forth, back and forth. So the contractor cannot, you know, that time lag, 1 month, 2 months before finance will mobilize resources, pay to Minister of Health, then you pay to the contractor for the contractor to start work. It does not help. So that was one of the principal delay. It takes sometimes 6 months before we fulfill the certificate, you know, and that cannot. So now we realize that, look, there can be a third party that can manage the entire project. Government can give GAMWORKS the funds, and GAMWORKS now will manage the contract, and now they'll be paying certificates as it comes. So it will not have to wait for 2 days, 3 days, or ministry to write to finance, for the PS to work to finance, to discuss, for the cash allocation committee to meet, to discuss and give money. So that was the issue why we turned back to GAMWORKS to be the phone holder for us, you know, as any other. But
before you go for now, you spoke about Mahfouz being the one who designed the project.
Yeah.
Was he only stopping?
No, he's still supervising the work.
He's still consultant.
Exactly. He's still the.
He did both design and supervision.
Yes. Yes. So now he's supervising, but GAMWORKS is now managing. Meaning now the office of the PS is now out of the day-to-day looking for money. You know, he just looked for money once, transferred the money to GAMWORKS, and now GAMWORKS deal with the contractor directly. So once the contractor put his certificate, the consultant approves, the GAMWORKS pay. You know, so that
I think Mr. Jaju. Yes, let me just remember. The issue of GAMWORKS, I'm coming after you come back. The issue of GAMWORKS. If part of GAMWORKS is they are giving GAMWORKS the responsibility of payment. They are not managing the projects.
They are managing the project.
Like, we supervising.
You know,
Mahfoud is supervising.
Mahfoud is supervising the project.
The contractor will send his certificate to Mahfoud.
Yes.
Mahfoud approves his certificate.
Yes.
And request a payment from you before. That's the way it used to be.
Yes, yes.
From your ministry.
Exactly.
For you to do the payment.
Yes.
Now it's no more your ministry.
Yes.
It's now Gangwas doing the payment.
Yes.
From where? Where are the funds coming from?
No, the ministry
Where
give
are the funds coming from?
from the ministry.
From the ministry?
Yes.
It's like you are spending more than expected.
Anyway, maybe you will see, but let me tell you.
Let me come here, because Gangwas also, you must pay Gangwas.
Yes.
You must pay them for their fees.
Yes.
You must pay them for their services.
Yes.
So you are spending more.
Yes.
So this is why when my colleague asked about the issue of management with your ministry, it's a concern to him.
Yeah.
Because having that there was proper management, there was no need to contract Gangwas. Because currently you are contracting Gangwas, you are paying more than the amount of you're supposed to do when you are doing it on your own. As a unit on your own. You just go to the Mahfoud to approve the certificate and say pay.
No, but it wasn't working.
Yes. Now the problem is, why was it working?
Exactly. So I think that's what I have explained earlier. Why it wasn't working? Because cash was not getting to the ministry on time.
And now
you know the IFMI system. No, you know the IFMI system. When you allocate money to the IFMI system, it is there. And another sector need money, and the ministry have 2 million, for example, in the system.
Now I understand that. Now my question here is, did you now pay the whole amount to Gangwas to say manage and then hands off?
Exactly.
That's what you did now.
Exactly. Not the full amount. We paid 70%, around 70%, one off to Gangwas, and then we say now manage. So which is now easier, is speed of the.
Let me just make it follow.
Yes.
I think you are trying to confuse us.
Yes.
But we are with you, don't worry.
Yeah.
The essence of involving Gangwas.
Yeah.
What was the idea? Or there's any MOU between the ministry and
Yes. Yes.
what was the MOU?
But we have a delegated management contract with Gangwas.
Why?
We want them to manage our project.
Because they have no capacity.
No, it's not about capacity. No.
Okay, wait. Now, what I have gotten from you is that
Yes.
is the payment plan. We got basic payments
Yes.
yes. from the ministry.
Finance. Yes.
Right.
Yes.
Now you put Gangwas as a third party
Yes.
to fast track the payment.
Yes.
Right?
Yes.
All right.
Yes.
Now, still now, it's same PS now who works with the Ministry of Finance and get money.
Yep.
And if this money is not in the basket, where do
no.
Wait. Why you involved?
If Gangwas could have made that from the ministry, why not you people? Because if you can build if you can build a capital project like this, and this is not small money, only payment, because of only payment, that want new people to get a third party. I don't see no reason you should do that. Give us a real thing. Why do you sift that? Why you invite Gangwas in this project? We want to know. Give us the reality, not because of monies.
Dollar by 60, 70 now is how much?
It's over 2 billion.
It's over 2 billion.
Yes.
Edward Francis Small is 147 million.
Yes.
And we don't have a third party because why? We have World Bank funds in the Gambia in Central Bank. Certificate come approved by the consultant, we pay instantly.
But remember, this is a World Bank.
No, I'm telling you.
Yeah.
I think,
No, please, let me just go ahead with this. Please. No, give me 1 minute. Let me run, I will go.
Yes.
Yes, World Bank give you 30 million, that's about 2 billion.
Yes.
2 billion, 10 million.
Yeah.
And you got to manage it.
Yeah.
It's not even from anybody.
Yes.
And you are running by yourself.
Yes.
How do the procurement goes?
Yes. Yeah.
How does this go now?
Okay. All right. So the procurement is we manage the entire procurement process.
How does this go?
You know, we do the normal tendering process. We recruit a firm to do the design, a consultant, which is IDOM. Just like in Edward Francis Small is master plan. Mahfouz. They do the design. They submit it to us. We did the tender. They help us in doing the evaluation, and we recruited a contractor to do the construction work. Contractor will do the work, bring the certificate to the consultant. The consultant will vet and send it to PCU pay.
It's a local contractor, right?
No.
Yeah, no,
Yes. Sapodi is an international.
Thank you very much. This is where I'm coming. No, this is where I'm coming.
They will tell you where to give the monies to. You know what they want? The work to be done. They are not there to control the money. World Bank will supervise their monies, and in fact, it's going to be an international tender. It's not going to be a local tender.
Yeah, it's not all World Bank will international tender.
But you can ask them.
You know, I'm just telling you. Let's see this way. You know, when it comes to projects, hence have their own PCU, like education, like all the ministries. So you transfer to Gamos. It also put into you that it was the same ministry that works with the finance minister to say, give me these funds, let me give it to Gamos. Was it easy that time for you to go to the ministry and say, give it to Gamos, or was it difficult for you to have it by the time?
No, you know the accessing of funds, different approach. When we agreed that we are transferring the funds to Gamos, what Gamos did, they did a cost estimate, how much they need as a first disbursement. So you cannot do that to a contractor. The contractor cannot tell you that this is what I need for a first disbursement. No, contractor deal with the certificates of payment. So Gamos said, okay, for us to execute this contract well, we need close to $50 million cash. Ministry of Health to transfer it to us for us to be able to push the contract, the works to go. And when we signed the DMC, we went to the Ministry of Finance. We said we want Gamos to manage this contract, and now they are requesting 50 million. And Finance agreed, and they disbursed 50 million, which was sent directly to Gamos. So that's it. But unlike during our time, you know, it is really very difficult to get access to funds when you really wanted to make payment to a supplier. Because what happened is, you know, the advance payment that you give to the contractor, he will have to spend and then come with additional, you know, exactly.
It's not only you. It's happening everywhere. Even on the roads, it's happening.
Yeah.
Certificates are also a problem.
Yes.
But the concern was the reason why you transfer to Gamos.
Exactly.
Now, on the floor of on that also.
Yeah.
I know there are additional funds.
Yeah.
Because they have project delays.
Yeah.
That's what?
You know.
The variation clause.
Exactly.
How are you able to manage with this variation?
No, right now, there is we are engaging Gamos and the Mahfouz to give us a variation analysis. So now they are QS now. We expect that by end of this month we should have an entire variation analysis for the Edward Francis Moore. So we've already written to them to give us a, you know, to give us a. No. The contractor is, you know, because there are some adjustments that were made during the work, which were certified by the consultant. So now the consultant is working on that variation list to be submitted to the ministry to actually.
Were they quantified?
Yes.
And can you not give us the current amount now? Because it was under something you associated.
No, because there was also work that was done by the hospital itself. For example, the ground concrete. Yeah. So the variation now has to be in two sides. We did additional work. When we did the assessment, for example, the entire yard was part of the work that we gave to the contractor. Exactly. But the hospital had additional funding somewhere. Then they did the yard. That empty.
The same contractor?
No. That's a different contract. That's why I'm saying is now the consultant is now putting all the pieces together. What should have been done by the contractor was not done, and was done by the hospital itself because they could not wait, or it was done before we launched the tender, for example. But an entire.
What the hospital did, they spent on their own to do some renovation. Was that part of the contract?
Before they.
Before the contract?
Yes, some of them were part of the contract.
They were part of the contract.
Yes.
So it's like you have to manage from
Exactly. So that's the job now the consultant is doing to submit to the minister.
And then they also give additional work.
Additional works, yes. Because there was additional work that was given to the contractor.
But it was also quantified.
Yes, it was also quantified. So that's the variance analysis now being done by the consultant.
Well, yeah, just quick. Already now, there's a variation clause, right? On that variation clause. Means now you.
Why go to extend asking Gamwok now on this variation clause now?
It's not Gamwok, it's a consultant.
No, he said Gamwok. He's here.
But the consultant is good. Gamwok is managing this contract. We have to understand when you are managing a contract, what do you do? So Gamwok is entirely managing the entire portfolio.
Then not because of coding.
Gamwok is supervising the consultant, not the ministry.
Now let me close it here. I want to request the MOU between the ministry.
You want the MOU?
Yes.
It's a DMC.
DMC. We don't submit it, please.
That's a request.
Yes.
I mean, yes. What I want us to understand here is about A, B, C, and happening. The reason why you are called is for you to help us.
Yes.
To give us what's on the ground and tell us your challenges. We need to know. If you know a challenge, we can also help you. But we are not only here to just to know for you and let you go. If you have challenges, as one of the members has mentioned, what are those challenges? What should we do? Is it Ministry of Finance? We just call him to finance asking why are you paying them?
Yes.
Why are you delaying their payments? But if you don't know it from you, you see us as we are let's not push and pull. Let's see other as one family, we look at the way forward and definitely see this country as our own country. And then to be honest, health is our concern. It's one of us concerns. We a private clinic, but that's why I say let me go and test my own hospital as a parliamentarian. But at the end of the day, I cannot imagine. It's like you spend money every day that could have come to government. It's not the private sector. So looking for the way forward is like this. You are building. We understand. But you only be stopped at building. So now you are given to governments to manage. They are there to manage for you. It's now Mafu who is going to do the contractor, and then they look at the variation clauses, and then add and minus, and then come with the final report to you. I think this is what we are all looking for. You're waiting for the final report. So now it's GAMWORKS to sit with the consultant. GAMWORKS is the managing firm, managing the consultant and the contractor now. From there, they report back to you. Honorable, Jawara, this is what they are trying to do. So now what he is requesting from you is whether we can have it and when can we have it? The DMC, when can we have it?
The DMC can be available
tomorrow.
Yeah.
So Honorable Jawara is saying tomorrow. Yes. We'll have it tomorrow. And then the other aspect of still on the floor on ongoing projects. Mr. Jaju, I think it's good to build new ones. We have no issues with that. Upgrading also is important. But the current existing health centers should be built properly. Before you build in a new hospital, let's say in Old Joshua, when there's a problem in Kanifing, why can't you upgrade Kanifing accommodation? Because I've seen something here. When you come to Birkama Health Center and the current Farato one, Birkama is a concern. It's a big time concern. Birkama, yes, the catchment area. But the population of Birkama and Birkama. Buyam also is understand because Buyam is what? Look at the Buyam area. The concern should have been you working to transform the Birkama Health Center to a hospital. If you want to wait on Farato and then Farato to take charge, I think Birkama should be looked at very carefully. Because the population of Birkama, currently if you go there, as you mentioned, that if you go there, people what? They queue for this. So what should we do? Should we change Birkama to a hospital?
Yeah, that's what in his presentation.
Yes, he made mention.
We stated that work is in progress. We want to build a hospital in Birkama. Initially, the plan was to renovate. We call them the 4 Bs. Birkama, Birkama, and Basi.
Yes.
So when we look at the cost of the renovation of Birkama and Basi, so the World Bank, when they look at the cost, World Bank advised it's better to go for new hospital. The consultant. It's better to build new hospital than renovation. Renovation, we may say 3 million and it may go beyond
10 million.
So they advise to seek fund from World Bank to build new hospital instead of renovating. So what delayed is for the construction of a hospital in Brikama was land.
Yeah, that's where I was trying to look into.
So we struggled before, in fact, we should get the land, the grant closed. Because they were not willing to give the land.
So what's the plan now for Brikama?
Eventually we had land, but still now it's a problem. We got the design already for the two hospitals, Biam and Brikama. What is it? Basse and Brikama.
So the fund is the problem now because the grant that was supposed to has already closed. So we cannot now we have to look for when there is a grant opening in another, maybe next year. Now we will lobby to build the two hospitals. But they have given us this design of the hospital, and they have already secured money to fence the land so that people will not encroach. It's between Brikama and Manduar.
Shortly after the police checkpoint.
After the police checkpoint.
On your left hand side, when you are going to Manduar, Busura.
Yes.
On the left hand side.
On the left hand.
Yes.
But I know it
But people are encroaching.
Exactly.
Yeah.
I mean, I think it would have been very wise before.
Yeah. They are secure and this thing.
So there's no problem here.
So
even the correction in Brikama.
it's a problem. This is not the first attempt to build a hospital in Brikama. We tried it even in 2019, but land was a problem.
Yeah.
So it's a problem.
That land, in fact, it belongs to Nari.
Which one are you talking about?
Nari, the land that they are now trying to occupy, in fact.
No, now we are talking about different things. We are talking about the Brikama.
Because the Lamin one belongs to Nari.
For the land?
Yes.
For the warehouse.
For the warehouse? Yeah, I think, PS and his team. I think we have to be very open to this. Next time, if things always happen, already Farato you have got the land. And Farato and Brikama is just very close. Very close. I think they have been very wise to use that money to build that kind of hospital around that area, at least not to lose the money. Because yesterday there is no land.
No, we did not lose the money. It was reinvested.
To what?
To other projects, World Bank funded projects.
For us, the concern that you Brikama is a concern. Namban, Banjul, and the one of Banjul. Yes, you are here.
So if you look at Brikama and Farato, they are close. But if you look at the catchment area of Brikama, from all the way from the border areas up to Brikama, now you look at Farato and it's now becoming over congested. So the need is there.
The two facilities functions differently. No matter how sophisticated facility you build, Honorable Chair, in Farato, you still need a facility in Brikama. That you cannot.
These are ministry.
So, Honorable.
Ministries occupying vast land in Brikama and they are using them.
Yeah.
That's not very fair. There are ministries occupying vast land in Brikama and they are not using them. Could have gone to them and give you those lands because this is about health. It's a concern.
Go there and get those lands and build. I mean, this is too far to discuss. Come to the PS works and say, works, we need this thing to happen. Give us your area. So
health is beyond health.
Yeah. So the other thing also, he wants to make a follow-up. Yeah.
No, I want to give the figure. I want to give the figure for Brikama.
Yeah, the figure. Okay, the figure. Before you ask.
I made a mistake to mention about 300 something.
390.
390. Instead of 3, for Buyam is 292 million 982.
Buyam 292.
292 million 982,194
million. Million, yes.
Okay.
Then for Brikama Bar is $170 million, $702,442. No, 100 and...
No, if we put the two together.
Yeah, if we put the two together.
What kind of work are you doing in Brikama?
Brikama Bar, we are
Repeat that figures, please.
for
Brikama.
Brikama $170 million, $702,442.
What kind of work are you doing in
Brikama Bar, we are renovating the whole facility
with new structures?
and with additional new structures.
Do you have the space?
And do yes, we have space there, expansion, yeah.
You have the space?
Yeah. Though it's small, but they managed to squeeze some of the. We are also extending additional dormitories.
Are you going to use the old one that they were in at the Manchester?
Yes, those ones are going to be renovated, and we put.
The project.
It's part of the project, yes.
So what kind of structures are you building? Are they going to be story building or what?
I am not privy to the design completely.
You know, the Brikama Bar is going to be a major health center.
Major health center.
Currently, it's a minor health center.
Yeah,
So based on the data and the population growth around Brikama Bar, so it is wise that you upgrade it to a major health center. So
whereby they will do
it will have
operation.
it will have maternity, it will have also board labor.
My concern is about the land.
Yeah, the land is
But the
small.
consultant visited it a couple of times.
And they did the design and everything.
So they did the design. We did what we call land optimization. You know, during the design. In fact, that's what took time. We have series of engagement with the consultant. So we have to make sure that we make the best use of the land. You know, that is there. So all these structures will actually fit in. We can supply you with the designs. You know, we can supply you with the exactly. We can supply you with the design, then you look at it.
Yes, just the conclusion on this Banjul project. I want to ask this.
PS.
Go ahead.
Yes, I want to know the actual figure that was approved by the Parliament on GLF fund 2024 for Banjul, yes. Because I was just trying to run down the yes, how much was approved by the Parliament. Because we are, critical about the payments of this, how to call it, the certificates. And yes. Yeah, then we compare with the certificates payments.
Basse and Brikama Bar, and these are going to be new hospital sites. So what are you going to do, especially in Brikama, because looking at the structure of the village, of the construction that is going to happen, and like the same thing in Basse. The other thing is, how do we expand on the oxygen that is being extracted from Lameng to other parts of this country? I think you talked about oxygen, eh?
Oxygen.
Yes. Yeah. Yes.
No, we have in Banjul and Demba and
Yes. So how do we consult them to other parts of the country? Yeah.
Thank you for coming. And then, Honorable Chair, looking at the agenda, I think it stated presentation on the capital projects under this ministry. What I was expecting is a full presentation of different projects from their ministry. Who is the funder? How much is the project cost? Who is the contractor? Who is the consultant? Has the project started?
At what level?
At what percentage? At what percentage? What is the timeline to finish this project? If there is any delay, let us know, if any. So because of why, all these projects, we need to visit them. We need to roll out and visit them. When we roll out, who to contact, like the contractor and the consultant. We need to know all those
projects where they are. That is my question.
Yeah, thank you. But that one would have been coming now because I wanted to tell you, send us an overview of all their projects.
Correct.
That is included here. Because we want to go along, we are going, we need to know all these things. So they will send us, I will take letters from them before we close the meeting.
Thank you very much.
Yes.
I'm Honorable Keba Tumani Sane. Yeah. So like you said, this is a family. It is what our people are telling us, or when we make our site visit, what we see and what we hear. That's why we do have to call them, maybe for them to update us. But sometimes, if you visit these projects, because projects have different phases, and then it is also making some approvals here, that we look at the figures, the amounts that has been approved, and then when you visit the site, sometimes it does not even need you to go to an economic school to be able to make judgment. But like you said, and like the previous speakers, what they said here, if you visit this hospital, this is why for me, when even they were insulting about this vehicle, my vehicle has one time turned to be an ambulance, my Prado. And then when you visit these hospitals, you look at the conditions there, even light. I was there one night just to make a visit because I said, like, I may be seen as an opposition, but I don't need to go to this place to visit and mislead the Gambian people. But while I was even there, the light went off. Even the nurses, they were even using their mobile phones. Yeah, I'm just coming. Like what you said there, the technicians are involved. Because like you said here, how can you just lay foundation stone for new hospitals when the existing ones are zero? You go there, the services are terrible, and you are coming up with new hospitals. And you are laying foundation for new hospitals when the existing ones, there is no medication. What is the purpose? So I don't know who is advancing, because if it is the technicians, that's why I'm calling these projects, because if you bring in new projects, why the existing ones are not even functioning? Let's be put it that way. Exactly. The new one, the existing ones. I don't know if either they are listening to the advice of the technicians or the politicians, because we have two sectors. The politicians are looking for popularity, but the technicians want quality. And it's the quality that we need for our people.
Thank you very much. Yes,
Assembly member for Serekunda. My concern is with all these projects within the health sector. I understand that there is a PCU, Project Coordinating Unit. So what is the role of this Project Coordinating Unit? And I have also heard of engaging the services of consultants, and at the same time you are engaging the services of GAMWorks. Will this not be a duplication of efforts? Already you have a Project Coordinating Unit. And again, I would like to thank the chairman for bringing you to the committee for us to perform oversight on your various projects. So these are just some areas that I need some clarity. What is the role of the PCU in all these projects at your ministry?
Yes, I mean, yes.
6 helpers within the country. I would like you to tell these committees what is the contract amounts, at what level of constructions, and what is the date of completion and the date of handing over to the ministry. Thank you very much.
These are the new projects, ongoing projects.
Yeah, the new ongoing project. Yeah.
Contract amount.
Yeah.
And then the completion date.
Yes, sir. Also, that's a very quick question, basically. So I'll just join my honorable colleague Jawara. Is concerned with regards to some of the projects that are ongoing. Yes, we understand that when it comes to having projects that embed external funding, like for example the World Bank, the ADB, among other external projects, when we harness these projects, usually they are quicker. Yes, we understand that when it comes to fund disbursement and other areas, it's more forthcoming than government. Usually there are a lot of bureaucracies. But if you look at the project timelines are always met when it comes from an external source. That's really some areas that we really need to look at and augment, basically. Because when you look at the FSTH project, it's from the GLF, basically. So yes, we know that you have constraints, especially when it comes to postings from the Ministry of Finance. But I think these are areas that you internally you have to discuss and try to see how to augment, because this is not like any other sector. This health, and any delay will have like severe ramifications basically. So I think these are areas that you have to really look internally. My question would be, when it comes to the EFSTH project, has the project scope changed basically? Has the project scope changed? That's my first question. And this is something that we've been asking time and time again over the years. Even currently, our oral questions, one of my questions are even part of it with regards to this. What is the final, can you guys give us a final timeline as to when exactly the AFSTH project will be done and up and running? Because it's a cause of concern for a lot of citizens, basically. Thank you.
Thank you very much. What you're telling is, what do you think that we can do together as a team? So we'll be going out to see your projects, your capital projects, go out and see how far have you gone with them and what your concerns are. So we will request from you to give us an overview of all your projects, so that depending on when we are going out, we will inform you that we are going out, and then see how best we can work together, and then to make it possible, because health is a concern to each and every one of us. I think you hear members, some of them are emotional when they are talking. It's not that they are not happy with you, no. They are concerned. People are going to them and complaining. So if they see you here, it's an opportunity for them to express their feelings to you as people responsible of health. That's why they are talking this in this way. To be honest, it's a concern. Likewise, in every one of you, even one of you, if I can guess, all of you are also concerned. So PS, you need to take note of this. We are here as a team. Health is every one of us. It's a concern to all of us. We want to see the health sector to be there. If not 900%, but at least 70 to 80%. What can we do? It's good to build. It's good to bring in structures. It's good to build in new ones. But after building, that's the question. After doing all these things, what comes in next? We build it, it is there. So they be lying down there for the sake of we build it. We build it and it is doing it's serving its purpose. I think the purpose, to serve the purpose is more important. The Banyan people are concerned about the Banyan project. They ask about it, when are you expecting to hand over the contract amount, the scope of the project, the change. What is the the current contract amount? You need to know. Some mention about the PCU. Yes, I know each ministry has their own PCU. They have a role and responsibility. They monitor projects and they implement projects. And they need to know. Government also is an agency on the sideline. Do you do contracts with them? How do you do come into contracts with them? What responsibility do you give them? They also need to know. So I think we hear from your response before we conclude. You can help us with this response. And then if we have any other things to ask, we can ask. Yes, yes.
Very much concerned with current developments, especially that of the Edward Francis Small Teaching Hospital. None of us are happy with the current situation. It has been frustrated for long. And I think we have a series of meetings among stakeholders, even at the highest level of the country. We are summoned there several times to have discussion on the Edward Francis Small Teaching Hospital. But the bottom line with Edward Francis Small Teaching Hospital is the cash flow. That's our biggest problem. Yes, the project was conceived, feasibility studies were done, the project was designed, the scope was the scope was well defined. We went through all the tendering system, competitive one for that matter. A contractor was awarded, and we have consultants who is overseeing the supervising the project. However, our biggest problem has been cash flow. We suffered several times. Anytime we approach Minister of Finance for release of fund, we have problem. That has been our biggest challenge as far as Edward Francis Small Teaching Hospital is concerned, cash flow. Nonetheless, when we had a series of meetings on it, and then we went to the office of the president on this, because the the president was very concerned, and Minister was summoned to the State House together with all the other partners, the contractor, Minister of Finance, and then other partners. We went there. It was agreed in principle that gum work be contracted, as Dr. Jibril said, to allow bulk payment of cash into gum works for them to be able to pay us when the contractor issued the certificate. That made tremendous improvement in the whole project management. And as we are going, we are moving steadily. I promise the Honorable House that we will give an update on the percentage achieved so far, the timeline, and then whether and the variations, once the analysis is completed, we'll make that also available to the Honorable House. So please bear with us. We are very much concerned with Edward Francis Martin Hospital. The situation in Demban is another uncomfortable scene for all of us. We are not happy with the condition, and we hope to decongest Edward Francis, to decongest Demban as soon as Edward Francis Martin Hospital starts full operational. Yes, the E&E is completed, but because other areas have been renovated, so we are using E&E now to shelter some of the patients that's supposed to be in the wards. So as soon as those wards are ready, E&E will start operational at Edward Francis Martin Hospital. So we'll come up with a definitive timeline, and that will communicate to this Honorable House. The issue of Bassi and Brikama,
the timeline, so you have to come up.
Yeah, we'll definitely provide the timeline for Banjul. For now, we cannot tell the timeline. We have to go back to our contractor and then the consultant. Yes, yeah.
No, the budget, the MOH budget structure does not specify each hospital. The hospital only have in the budget the OCs and PEs. For the renovation, it's a one budget line that you will see on the development, whether it's health facility, but the amount has been used.
What he's asking about?
Yeah.
A budget for Banjul Hospital, the parliament budget.
No.
There is no budget. No, not now. Before the start of the project.
Honorable Chair.
Yes.
A budget line of 311205, where he is coming.
Yeah.
Health centers.
Yeah.
Clinic,
yeah.
and health facilities,
yeah.
They are all down.
Yeah.
Now, this is why I asked you, the budget amount is how much? And how much was budgeted? Because now it's meant for the entire country. What do you remember that you are doing? But if you are trying to exceed, if the capital budget is exceeding this amount, means you are in trouble.
Yeah. No, that's true. We understand what you are saying. Yeah. Edward Francis Ward project has been on for the past 3-4 years.
Because
so
what is needed there is 133 million.
Exactly.
How will you spend there now?
So the Edward Francis Mall, what we have spent might be close to 100 million.
It's more than that.
For example, or more than that. So no. What we have already spent. So this year, this is going to be a surplus.
No. I think there's an issue here.
Yeah.
The contract amount.
Yes.
Was stated.
Yes.
I know every year there is a budget from the Ministry of Health that goes on our rehabilitation.
Exactly.
But the concern here is, if you look at the previous amount, there was a contract that was signed. Already the contract was signed.
Yep.
How much was the amount?
The signed contract?
The one signed contract.
Yeah, it's around 147 million. We'll give you the actual amount.
Yes.
Yes, but it's 147 plus something.
Yes, what I'm saying.
Yeah.
The signed plus already. Yes. The signed amount was 147.
Yeah.
Let's estimate as 147.
Yeah.
Currently, as you mentioned, there were other variations that comes on board. And there are also other works that were done by the hospital that were supposed to be done by who? The contractor.
Exactly.
So still within the 147, how much was paid to the contractor?
Exactly.
We need to know.
Exactly.
How about the amount, the current amount that was disbursed to the contractor?
Exactly.
From 147.
Yeah.
And after your final meeting with both the consultant and with the contractor, you give us your final amount of variation so that we can compare both the original amount, money, the project, the part that was being done by the hospital, and also the new jobs that comes in. So that we can know the current figure of the contract.
Yes.
Madam Chair, you know, what we have approved is 133 million. All hospitals, clinics, and health facilities. Not only Banjul project. Now, if Banjul project is 147, means now they are out of the envelope.
Yeah, what we are trying to do here is,
No, I'm coming where the constraint of getting money is now.
Yeah, I'm just,
if a project is not projected and it's not budgeted, it will be difficult to get money.
Yeah, let's see this way. Let's see this way. I think the Banjul project and what is budgeted in your project is a different.
Yeah.
It's a different.
Can I just want to summarize so that you understand better. When we are doing the budget for 2024, we've looked at the budget balances for the remaining infrastructures that were financed by the Gambia government, GLF. That's what we factored in this year's budget. Exactly. So which includes the remaining balance for Edward Francis Small, the remaining balance for Polyclinic, the remaining balances of the other. That's what we have forecasted for this budget line.
Yeah, we understand.
Yeah.
This year's budget was focused on the remaining certificates.
Exactly.
The remaining certificates.
Exactly.
The remaining work on the ongoing projects.
Exactly.
That's what gives it some amount.
Yes.
And then with all that, there are still new ones that comes on board that we are not factored for.
Yep.
That we are not budgeted for.
Yep.
So we need to know all these things. Get us this PS, the contract amount, the variation aspect, and the new works.
Yeah.
Then we need to know. You send it to us.
Okay.
Yes, PS.
Okay. About the Basse and Brikama new projects, what is going to happen to the structures? The Basse will be converted to polyclinic, the current structure, just like Brikama as well. So they'll be used as polyclinic. So if the new structure is erected, the new hospital is erected. So the oxygen plan, you also asked about that. Currently, Bansang oxygen plant is up and running. What we are doing for the moment, other health facilities will send in their cylinders, and then they get the oxygen from there and they transport to their various health facilities. So that one is ongoing. Concerning about the renovation and maintenance of other health facilities, it may interest to know that the ministry has started renovating 13 other health facilities. I mean, there are so many compelling and competing priorities. If you look at the country, most of the structures were built so many years ago, and then they all required one or the other to be maintained and then renovated. And again, we want to inject quality into whatever we are doing, and then quality system demands so many structural changes here and there. So as a result, the ministry is looking for funding to look at all those things and then see how best we can renovate almost all the health facilities across the country. But resources are constrained. So at the moment, we are targeting 13 health facilities to be renovated, and then hopefully that will start soon. The issue of
it will be ready soon.
Soon. The issue of PCU facilities, yes.
You are targeting.
Yeah.
That we are renovating.
Renovating. That started. The work has started already.
And it's financed by whom?
World Bank.
By the World Bank.
Yes.
By the amount.
We'll get the amount for you.
We get the amount.
Yes. Okay. Yeah. So you'll see that. I mean.
And who is supervising the project?
Master plan.
Master plan.
Master plan is doing supervision.
Yeah.
With your PCU unit.
With PCU and the Directorate of Planning and Information. Yeah.
Doing together.
Yes, please. Okay. Then the role of PCU, I think, as asked by my honorable member, I mean, it's not different from any other PCU. Basically, it's to coordinate the progress within the Ministry of Health and to, the implementation of the, and also to oversee the implementation of the projects across the ministry. The beautiful about the PCU is that it avoids duplication of efforts, duplication of progress, and then it also harnesses donor funding landscape. So that's the beauty about PCU, and I think the PCU are doing a good job in terms of project management, in terms of financial management, and other aspects of coordination. one asked about the project scope at the Edward Francis. Yes, the scope has changed slightly, and as requested, we'll ensure that we provide all the variations before the end of this week. Again, that variation somehow okay, translated into the fact that the time frame has also changed. So, before the end of the month. So, well, that's just nice. That's nice. Yeah. So we'll ensure that the timeline is also communicated appropriately. So I think these are some of the areas that were asked. So, I mean, come.
Yeah, thank you very much. I think we have seen many somebody of cash flow that this used to be a problem before the transfer to Gango. There are issues with cash flow. That's why the project wasn't going. And without cash, you cannot do the project. And contractors also depend on money to move ahead. If they are not paid their certificates, they cannot move. So as far as you have transferred the project to Gango, before this debate is used to be, you used to contract Gangos, and Gangos do the work for you. But when these issues are set up in this ministry, I think what is causing the delays. Next time, if they are not World Bank projects, our advice to you is to sit with the agency, discuss with them, and contact them out and say that at least you can have other things that you need to do. Because health is not only on projects, you have to do. So if projects are occupying you, you cannot move ahead, then you have an agency in this country. The advice is contact that agency, discuss with them, and then say, this is what we want, put this first, and then hands off. Then from there you are relaxed, you can go time to contact and supervise and inspect and come back again. Then all the time taking the burden of doing it and then it comes out front to you. I mean, it was doing that was a long time, then by having a history now. But the delay was caused by CAT, as you said. You can't blame you for that. But next time, engage the agency, discuss with them, and contact them out. The one you can handle them.
You are still there?
The other thing also is about the new ones that are coming. Yes, it's good to build new health centers. But the old one that needs to be upgraded to a level that at the end of the day, we don't need even to build next door health center. Like in Banyum here, you want to build one in Pacifica, I want to build here one in Lancaster, which in the same area. Why not build the one that's in Lancaster, upgrade it, and allow the people of that area to access to it, than just to build for the sake of buildings. So we are appealing to your ministry to at least push up, especially the issue of Banyum. With Gango, the contractor, let them do all what they can do to make sure that as time is given, they do their best to finish this project so that Demban can be at least decongested and Banyum start moving. But if you go to Demban now, honestly, it's a problem. And it's all caused by this result in Banyum. Because Banyum is not ready. And the refers are all used to be in Banyum. If refers are all in Banyum now, it's a problem. So PS, if your ministry, who's the contractor? Who's the Ministry of Finance? Do you have issue with finance? You have a committee here that is responsible of health. Liaise with them to help you and meet the ministry. Meet the minister to say we are having a problem. Because as he mentioned, there are questions that are always coming with the issue of Demban and Banyum. So what can we do? So PS, take it up with the minister to see what we need to do and as possible. So if you have any word to say,
Thank you very much, Chairman. I'm greatly honored by this opportunity. First of all, let me apologize again, because I have been in this business maybe for a number of months. I have never come late to the Parliament. We know the importance of the Parliament. We know the pressure you are going under, because you are the one communicating with the grassroots. So definitely, that is the apologize that we want to repeat again. Secondly, we are as concerned as you are, because we are also citizens. When I joined the ministry as permanent secretary, I stopped going to the private clinics. The first public clinic I visited was Demban myself, because to feel it myself. So the first day I arrived with my child, the same thing. So I could see the difference. And I'm as concerned as you, not because of hearing, but I'm tasting it now. So I promise you now, we'll do our best. It's not easy. In a country where everything is urgent, to prioritize urgency is also a skill. And I think as a ministry, we will just do that. As ministry, we are not looking at the half full bottle. We will try to look at the half empty, because at least your achievement is good, but where are you not doing better? Where are you going wrong? This is why we promise you that we will try to do our best. He mentioned about PCU. The reason why PCU came because of the volume of transactions that, of course, the ministry could not longer. And the PCU of the ministry is paid by the World Bank for your information. So they came. It's not paid by the government. Of course, it's paid by the donors, not only World Bank but by the donors. So for them also to make sure now that all the projects that we have, because health is very multifaceted and it's very complex. So they are doing their best, but we still need to do more, and we promise you that we will do more. So these are a list of things that you ask us to do. We will, inshallah, give them to you, and we would have also expected that this presentation will be done, and next time, inshallah, we will do it, live for you to see. So with that, I would like to thank you for your understanding. To thank you and wish you well. Thank you very much. Assalamu alaikum wa rahmatullahi wa barakatuh.
Yes, PSU is paid by the World Bank.
Donors.
It's just for
By the donors.
No, donors.
By the donors.
By donors.
Yeah.
Is it only for donor projects? Are they only considering only on donor projects, or they are also only considering on donor JLM projects?
All the projects.
On all projects.
On all projects.
Yes.
Within the health sector.
But that's their job. Yes.
Yeah.
Yes.
Thank you very much. I think we allow members. Yes.
I don't really respect you have closed, I should not stay. I think what I just want to tell you. Yes, no, I know you close. I can also break the door.
Yes.
When the politicians are interfering in your and you can be because I know how technicians
Politicians are interfering in their work.
No, what I'm saying,
I'm
there will be proposals of laying foundations for everywhere for hospital. When executive ones are
Yes. The question here is, we are staying. Let's stay. No, don't go. We are staying.
I have a lot of
No, stay. Explain. Our guests can leave. With your team.
Thank you very much. Thank you very much.
It
was good.
It's my
Thank you very much.